Hey everybody, Devin here with Heartbeat Debrief and welcome back. For those of you that are new here, this is the place for the things that don't make it into our charts. The doubts, the dark humor, and the weight that we carry with us long after the shift is over. Now, today's episode is one that I think that the majority of you can probably relate to, and it's that internal question of, should I go to nursing school? And to help me talk about this topic, I'm bringing in a good friend of mine and mentor, Zane Atencio. He is an educator and a flight clinician in the southern region, and he brings a very unique perspective to this topic because his journey, I would say, is probably not very similar to the majority of us. However, you will find similarities in his journey that he has taken, and there are probably people out there that have followed the same exact journey as him. So, I hope you enjoyed today's episode. Make sure to hit that like and subscribe button, leave some comments, leave some reviews, and with that being said, let's get into it.
The views and opinions expressed in Heartbeat Debrief are solely those of the host and guests. They do not represent the views of any employer or organization. This podcast is for educational, mentorship, and guidance purposes only. If protocols or policies are discussed, always follow your local or state organizational policies and procedures, regulatory guidelines, and scope of practice.
All right, everybody. I'd like to take a moment and welcome our guest to the show. Zane was one of my paramedic instructors from way back in the day and has kind of become a mentor and somebody who I look up to in this line of work and has really kind of helped, I would say, mold me into the practitioner that I am today by proxy, because him and I have never worked together or ever have worked together, I should say. But he really does lead by example. And so I really hope a lot of you enjoy today's episode because I think that a lot of us have kind of gone down the same journey that Zane has gone through. So with that being said, Zane, if you'd like to introduce yourself to our listeners and kind of tell them a little bit about who you are and what you do, and then we can dive in.
So my name is Zane Atencio. I'm a flight nurse and flight paramedic out in Austin, Texas. Been in EMS since I was 18, right off the bat. Started as an EMT, found out couldn't drive an ambulance at that time. That's how long ago that was. And became a paramedic. Went on to get my bachelor's in paramedic care out in Arizona from NAU. Went to Fire Academy, just allowed me more mobility at that time. And then care paramedic program at Creighton. Then went on, got my medic to RN, started flying as a paramedic, got my nursing experience, transitioned to flight nurse role. Fast forward, got my BSN. I'm currently finishing up my DNP as an acute care nurse practitioner at Baylor. Got a year and a half left of suffering with that. And we'll see what the plan is for that once it's finished, but I have no plans to quit flying at this point. So that's kind of the large overview.
Awesome. So what made you want to get into EMS like right at 18?
So my story is kind of, I think, one people don't talk about a lot in the sense that, like, I didn't know what an EMT did. Couldn't tell you. I was doing prereqs
Fair.
for nursing school,
Fair.
and I was just kind of being a 18-year-old who found some freedom, and I was not doing great in my classes, and I had saw that there was an EMT course posted on the Pima Community College website. I was like, oh, one semester and I can have a certification? Sounds good. So
Why not?
yeah, why not? So signed up for that, and everyone, the first day of class, I will never forget. They're like, all right, what's everyone doing in here? And, most of the people were like, oh, Fire Academy after. And then one girl next to me, Haley, she was like, oh, nursing. And I was like, nursing? I don't know. And that kind of then spiraled from there. Started TAing for the EMT course because I couldn't work after. So just helping with skills. And then same thing, was kind of going down the now lazy 19-year-old at that point. I wouldn't say lazy, just spirited. And then I saw a paramedic course, and I'm like, don't know what a paramedic does still. Sounds good. It's a year. So then I called, and Tara Henson called me the next day and was like, you can interview. I'm like, 2 days if you're ready. I'm like, sure. And showed up and with platinum bleach blonde hair, backwards snapback gauges. I had a septum painted on skinny jeans, were my trademark at the time. And I had my EMT shirt cut on the sides. And I'm like, wow, everyone is dressed
Wow.
really nice. What are you
Wow.
wearing? He's like, oh, these are class A's. I'm like, cool, man. Yeah, great. And there I am looking a mess. And Dr. Herbert's face was priceless. She was like,
Oh, I can
oh,
imagine
she
her
gave me
face.
so much flack for that years later when I was the other side sitting on interviews for the medic school. She was like, remember when I gave you a chance? I'm like, oh, I do. Yes. So yeah, that kind of got me introduced to EMS, and it really, I had no concept of what EMS was, honestly, until I was like mid paramedic school, and I was like, oh, um, and I'm glad I did.
I
So
get it now.
yeah, exactly. So,
Wow. I could I mean, I can picture it. I can picture your interview style, because I know you. But I think I probably would have paid money to see you walk into an interview dressed
oh,
like that.
it was rare form. Yep. I hope maybe there's footage somewhere at Pima. I would love to see it.
I'm oh, I'm sure there is. I'm sure there is. Um, wow. All right. So with all that being said, you started on this journey of not really knowing what this career field was, or what really you were going to do. When did you know that this was the career path for you? Like you had said you were going to do prereqs for nursing, but then you stuck in EMS. Did something inside of you be like, you know what? This is what I want to do.
Yeah. I actually was just talking about this story recently. So when I got pretty much towards the end of paramedic school, or maybe three-fourths of the way when we started clinicals, I was, doing the fire rotations, doing the night shifts at the hospital at Banner, Tucson to do like our bedside time. And I was like, oh, medicine's really cool. This is awesome. And,
Hmm.
getting to intubate before I could legally drink was crazy, like the gravity of that. And I
Yep,
remember
yep.
texting my grandma and my dad, and I was like, oh, I just did my first intubation with Vickery at St. Mary's. And she was like, "Oh, that's awesome. Congrats." And my dad's like, "Incubation?" And I'm like, "No, intubation." My grandma was like, "It's a
No,
big deal." And I was like, "Yes." And really made it stick, though, was the way that my preceptors treated me and took care of me during that time. Of course, at paramedic school, I had a hard time with family and all of that, and ended up essentially homeless for about a month. And so I was doing the couch surfing thing, and then walking to class and taking the bus. And the way that my classmates stepped up, would pick me up, my preceptors would feed me without me asking. Like, it wasn't an option. I was like, oh, and they're like, no, I didn't ask that. What do you want to eat? And I was like, oh, okay. And then, the different Tucson Fire paramedics would drive me between stations for clinicals. And I was like, not only is the medicine impactful and cool, right? But these people step up for each other, and every single one of them comes from a different walk of life. No one
yep.
there, no one has a linear path that we all think we're going to get when we go through life. And that is why I was like, oh, this is the community and the field that I want to work in and be involved in, because, just the strength and the candor and all of that these people gave really was impactful to me.
That's awesome. I mean, I think we all have impactful like preceptors and who've gone out of their way to teach us the medicine. But I think that your preceptors, by going even more so out of the way and, you know, really bringing into the family, is what I would say is that EMS is like a second family.
Yeah. I mean, we spend a third of our lives with
Sorry.
these people on shift. Well, at least. So,
Exactly. Yeah. Sorry, my dog's in the background running around. Yeah, no, we spend way more time with these people than we do our actual families. 12 hours inside of a metal box, inside of a helicopter, inside of an airplane, inside of a house, whatever it is. We spend a majority of the time with these people. These people know us maybe better than our family does.
yeah.
Potentially
Mhm.
see a different side of us emotionally, and it brings us stronger together. So
I would agree with you that this camaraderie and this community that we all have, for me, that's what made me want to stay. Looking back, you know, joining the military, starting out as an EMT, and then going to paramedic school out in Tucson, you know, all of that and the people that I've met along the way have really shown me that this is the job that I was meant for. And the people in this job, they are with you through thick and thin,
Oh, yeah.
no matter what.
Oh, yeah. I would say my coworkers are the rare few on this planet who have seen me cry. Let's say, but you're right.
Yep.
We get each other on our worst varying emotions, days, and all of that. And a lot of times it doesn't even have to necessarily do with the call or anything, but life gets thrown at you and you're on shift with these people.
Mhm.
Life doesn't stop just because you're on shift. And,
Right. No.
so it's interesting how those all kind of develop. Like I can't imagine not having, my coworkers and people I've met along the way. I was just in Tucson a couple weeks ago and I met up with my old drill instructor from Fire Academy just because we wanted to
Oh,
catch
well.
up and, so
Right. Yeah. No. And you make these long lasting relationships. I mean, shoot, I graduated from FEMA 10 years ago.
oh, make me feel old. Oh gosh.
Yeah. Exactly. Yeah.
Yep.
Yeah. And, you know, the people that I've crossed paths with since
Yep.
then, I'm still good friends with, and the people that I sat through those ungodly long days, like I still talk to.
Oh, yeah.
Like I don't know,
Like
it's
Audra and
it's
Rira are
different,
in San Antonio and I'm in Austin now, and I'm like
right?
friends. Like, you know,
Exactly, friends. Yeah, it's wild to me, and I take a look at the Echo Future Flight Crew class. That was 2 years ago, and we all still talk to each other, I would say, on a weekly basis. But like, there's things that you experience in life that you just can't not bond people with,
right.
or bond with people through. Yes.
Suffering
Yeah.
together. Yes. Hmm.
Exactly. So you went through this EMS phase, and when did you realize that you wanted, or rather, that maybe nursing was an option?
Great question. So I was working at the fire department. I was about 3 years in, and I was loving it. Fire's fun. I really enjoy the family aspect I was talking about and the structure. I think I always craved something that was structured like that. And we, of course, being a rural fire department, would call helicopters and we would fly with the big three, companies. And the
Mhm.
company that was the most impactful to me is where I work now. They responded, and I was always hoping it was them that would show up because
Mm.
they were so kind. They didn't treat me like I was stupid, like some stupid ground medic bothering them, which is how the other two made me feel. And, they were fast, they took time after like, they'd come have breakfast at the station if we had a rough call to talk about it, and be like, "Hey, next time,
That's awesome.
remember this, this, and that," and then I started doing ride-alongs with them, and, you know, I was from the ride-alongs with them, they were like, "Hey, if you're gonna do this, if you have the availability to become an RN, I would recommend that," and I'm like, "Okay,"
Mm.
and so they kinda put that bug in my ear. They're like, the pay was the biggest thing. And in Arizona at the time, I don't know if it's still the case, the scope of practice was largely different. So
Ah.
even if you were flying, the paramedic could not do chest tubes, simple thoracostomies, initiate
Hmm.
blood. And we could only
Interesting.
could not push long acting paralytics. I couldn't push VAC. It's just very strange, archaic
Odd.
stipulations.
Yeah.
And with that, I was like, well, if I'm going to change from the fire department to this, I want to do it to my highest capacity. So I found a medic to RN program. Wasn't even sure if that was the right call. And kind of the same thing. The snowball happened really quick. Got in first try. And then I was driving up to Phoenix from Tucson and met the best group. Like it was a paramedic to RN program specifically. So our first semester was only paramedics. And I
Mm.
still talk to most of them like routinely, like once a week at least, because we
Nice.
really suffered together. And all like people who have been paramedics for a couple of years and at least. And, you know, then we bridged in with the regular nursing cohort, and we are like, oh, we're all going to sit in the back and be quiet. Got it. Yep. And which
Yep.
that just is, no one likes a know-it-all. So, but that is kind of like the snowball from there. And actually backing up, really the big transition point on top of the ride-alongs is when I did the CCEMTP program through Creighton, so semester long, and that included
Mhm.
36 hours of ICU rotations. And I was like, okay, there is so much
Yep.
I don't know that I thought I knew.
Right.
And I was like, well, nursing school is going to afford like I was just watching those nurses and they were just running circles around everything. And I was like,
Mhm.
oh, and I was like, I considered myself at the time a decent medic, but I was like, there's clearly a gap, like, you know,
Yep.
and so I was like, okay, well, if I want to obtain that knowledge and I'm going to fly, and then of course we interact with flight teams in ICU there, and like, I was like, oh, okay. So that was kind of my drive. Knowledge, money, honestly, and I think people are scared to talk about that, but it's the truth. The RN makes more.
It's
It
so
just is
true.
what it is. And
Yeah.
as paramedics, we are always beat down and have multiple jobs by necessity. And
Right.
that's what all the older paramedics would tell me. They're like, you don't want to do it in this fashion if you can. And then I was like, well, if I can be in EMS and be an RN, this is probably the best solution. And I still didn't know if I wanted to leave the
Right.
fire department officially. I had toyed around with going to Colorado and working for a large department there I have some mentors with. And even, gosh, I even toyed around with that probably 3 or 4 years ago, going back and leaving flight to go back to
Mhm.
fire.
I'm
Because I'm like, I can work per diem as a nurse wherever I want. Like, who cares? Um,
yeah.
so yeah, but really it was just accessibility to knowledge. And I knew that as a medic flying, I was at the going to be at the terminal point of my career as far as medicine. Not to say I couldn't go into management and do all these other things, but I was like, okay. As a nurse, though, I was like, well, if there is ever a desire for me to expand, I can go to NP school. I can go to CRNA school. I can do other things. I could even use that BSN to go to med school if I wanted to. Um, Not that I couldn't do it with my bachelor's in paramedic care, but it just gave me more mobility for the uncertain. And coming off a very uncertain start, I needed something that was going to be the most stable.
No, I get that, and you bring up a lot of good points. The knowledge for sure. I think that's what drove me to kind of pursue a very similar path. This thirst to just want to know more, but also be a better practitioner and provide better care for my patients.
Mhm.
But then, as a paramedic, we we can only go so high up this very narrow clinical ladder.
Yeah.
Uh, I mentioned in a previous episode that we have this very narrow clinical ladder, but then you go into nursing and it's not a ladder; it's more of like a tree. And there's so many different branches that you can go in anything clinical. And then if you want to jump ship from clinical to admin or whatever, there's a whole other tree over there.
Mhm. That's what I keep telling people with
So
nursing that they don't understand is, well, I
yeah,
don't want to touch patients. You don't have to. Once you're an RN,
you don't
you
have
can do
to.
anything in healthcare, even adjacent. You can go do insurance from your bedroom all day if you want to do that,
Right.
you know?
Right. You could be a legal reviewer
Yeah.
that sits at home
Hmm.
9 to 5.
Yeah. Yeah.
Yeah. There are so many different jobs that you do not have to touch a patient ever in your career if you don't want to do that.
Right.
And EMS, I think, does a really bad job at affording that to everyone. Those jobs don't exist for EMS professionals. There are the one offs, and I've seen them, but they're not in abundance
Right.
like nursing.
Well, even if you think like
Um,
what I know at my fire department, our CQI person who reviewed our charts was an RN. And so, and I
hmm,
would say,
interesting.
I know a couple fire departments who do use an RN to review their charts, even out in California and other places. So I
Why?
was not sure what the reason is. I imagine probably I'm sure it's something with like the state or who knows. I don't know if it's a requirement, but
Probably.
and then a lot of the pre-hospital coordinators could be RNs or paramedics. And I was like, well, I don't want to
Hmm.
be a pre-hospital coordinator. That doesn't look very
No.
appealing. more power to him. Thank you for what you do, comma.
Right.
Yeah, but
Absolutely.
not me.
I don't want to do
Nope,
that.
nope. Yeah, having the mobility really was a big factor for me. So
And with all of that, with that, that mobility and flexibility, you bring up pay. And this is a hot topic throughout EMS.
here we
I know
go. Here
that.
we go.
But it's still absolutely wild to me that we have departments when you reach that top tier of transport level, right? That has that huge pay disparity because I would say 90, 85% of the departments operate the flight paramedic and the flight nurse to the same level. Yet the nurse makes, I don't want to say double, but a
Significant
a good
amount.
chunk,
Yeah,
significant
a
amount
life
more
changing
than the flight
amount.
paramedic.
Yeah,
A life changing,
yeah.
right?
Mhm.
For the same exact job, and they're expected to do the same exact tasks. Um, Granted, the knowledge base is a little different,
Yes.
but each one specialized to their own field from where they came from, and I can recognize that.
Mhm.
It's shocking to me that we're operating at the same level, we're doing the same thing, but we are not making the same money.
So yes, this is something I get carefully asked quite often. So a couple
Yes.
thoughts on this. Uh, you know, First off, I want to say the knowledge that you bring up. When I
Mm.
transitioned from paramedic to RN, I was truly shocked at how ignorant I was in medicine. I thought
I agree.
I was teaching, I was in the books all the time, and there was still such a aggressive gap that I thought nursing school was hard. I'm not going to sit here and say even a medic to RN program was easy. I was shocked how hard it was.
Hmm.
In fact, I was like, "Oh,
Agreed.
yo!" I was like, "People are doing this just like raw with no paramedic experience. This is hard." And just the amount of generalized knowledge that you get in nursing school was just very intimidating and very overwhelming. And
It's so different
it's
though.
so different. And yeah, of course, when it came to skills doing clinicals, yeah, throwing IVs. I remember helping run a code one time, and my preceptor was like, what do you do?" And I was like, "Nothing."
You've done this
He goes,
before.
"Nuh-uh, Are you a medic?" And I'm like, "Yes." He goes, "Okay." He's like, "Caught you." And I'm like, "Oh." So
Shh,
that,
don't tell
yeah, I
anybody.
was like, "Shh, don't embarrass me." But that
Yeah.
brings and that's a good example of bringing in the knowledge and experience I got from being a paramedic. I'm 100% a better nurse because of it. But
Amen. I
um,
agree.
the every time I've leveled up, quote, quote, in my career, even in doing my DNP right now, I'm like, okay, I feel like I should have known that probably 6 years ago. That's
Hmm.
terrifying. Just I was just floored, honestly. And when I transitioned from flight paramedic to flight nurse, even though I went through the same academy and I thought we were doing the same job, the weight of being the nurse on that, especially in a state at the time where the nurse had the ultimate liability and scope, and this is not the case for every
Mm-hmm.
state, I was even then humbled again. I'm like, "Oh my gosh, this is on me." And I was like, and I'm an ER nurse at the time was my only experience. I was like, I don't know what to do with this balloon pump. Like, I know, like, from our training,
Mm.
of course, but I'm like,
Yeah.
okay, if something
Right.
goes really sideways on this, do I understand it deeply? And
Mm.
so, and then when I came to Texas, paramedics and nurses here are equal scope wise. There's no difference. This is the only state I've flown in that is like that, to my knowledge. Like California, for example, out there, I don't even get my paramedic license there because it changes by county. And
Right.
the paramedic scope is aggressively lower there. Like I can't intubate
Yeah.
under the age of 8, can't crike, can't do
Correct.
chest tubes. So I'm like, well, and so we just fly RN out there, even though yes, I'm a paramedic, but as far as we're charting on paper, I just was very floored by that. So personal opinion of it is there should be a pay difference, but it should not be so disparagingly different. I think the pay should be different because I like thinking back to my original nurse partner. Gosh, I probably stressed that man out to all high hell because I was a new grad nurse flying as a new flight paramedic, and like I just think about all the very ignorant is just the best word. Ignorant things I said or did. And looking back, I'm like, well, he was right because he has that extra experience and knowledge. I'm like, oh my
Right.
gosh, it's just embarrassing to think about sometimes. Donnie, thank you. I love you.
Yeah.
But yes. So like, for example, ballpark, the pay disparity is probably about 30 to 34,000 different. I think that's aggressive. That's
I,
too much. 10
I would agree.
10,000? Yeah, I think that's reasonable.
I, yeah,
Especially when it comes
absolutely.
to licensure. Like, fine.
Right. Especially if you are going to operate in a state where the nurse does assume all of that liability.
Then yes, you should be paid accordingly.
Like, right. Like, to my knowledge, I think Colorado is probably the same.
I think so. Yeah.
At least for me on the stroke unit, the nurse has the liability,
Right.
unless the patient turns into a true like pre-hospital, no longer stroke emergency, then the paramedic takes over.
Gotcha.
Then the paramedic assumes responsibility.
Okay. Interesting.
But an initial, yeah, it's a little strange, but the initial like patient contact and everything, the nurse operates and then uses the paramedic as needed and relies on them for 12 leads and IV access and meds.
All the ancillary things we have to do.
Exactly. But I think if the nurse is assuming all of that liability, then I think that 10,000 disparity is probably acceptable.
Yeah.
But if you're operating in a state where you both share that same liability, you should not have a $34,000 disparity.
No, it's insulting, and
it is.
I think what I've seen that Texas does well that other states I wish would adopt is that if you have a degree, you can be a licensed paramedic. And that is a distinction
Yes.
versus the certified paramedic. And, as EMS, we want more pay. We want to be treated equally. We want to be like the nurses. But no one, as a generalization, wants to push for us to go get degrees and all of that. Yes, I know you don't need a degree necessarily. It does not necessarily make you a better or worse paramedic, comma. It gives you more expansion, more knowledge. Like, one thing we fail at largely is actually understanding how to look at evidence, for example. Like, so, what is a p-value? What does that mean when you're looking at evidence? What is peer-reviewed articles? Not just I'm looking at ems1.com. Sorry, not trying to break, you know what I'm saying? And they do a good
Just
job.
Typical news articles.
Correct, yes. And one of my coworkers, I'm sure most of you follow her, the pre-hospitalist, she posts very good. Oh, she's the best. Great peer-reviewed articles, but breaks them down. And I'm like,
yes,
but she has a master's and she's worked hard to understand and do that. And I'm like, what a freaking badass! Like, and yeah, I understand that everyone has access to get secondary education, things like that. But I do think it's on the profession to give us opportunities to get access to things like that. What's our incentive? My pay doesn't change.
Absolutely. No, it doesn't. Like, I remember Pittsburgh and got my bachelor's in paramedicine. And then I was like, okay, so what does this do for me? I did a focus at education, which phenomenal. It afforded me to, be able to teach at one of the local community colleges here. Took me down a different line of like thinking and development. But then I was like, okay, what else can I do with this degree though? Because my ambulance service that I was working for at the time was like, cool, you have a bachelor's degree. Great. I was like, okay. So I did 4 years of school, just like a nurse in a very different field, but still a 4-year degree program. I don't get any extra pay. I am still working at the same job, same capacity. It doesn't do anything for me. And I feel like that's probably the majority of us that go down this path. We get to the level of, education or critical care transport, excuse me. And we get these bachelor's degrees and we're like, okay, what do I do with this now? I can't, it doesn't, there's no
it looks nice on my email signature, I guess. Yeah.
Right. There's no added benefit for us in EMS to go to school and further our education, whereas nurses, you have CNA, LPN, ADN, BSN, and I'm not knocking anybody out there that has an ADN because I have worked with phenomenal nurses that just have an
Would
ADN.
argue they're better. They're better
And
sometimes than BSN nurses. Yeah.
exactly, because the ADN programs focuses solely on patient care, and
Mhm.
then you take these BSN standalones. You get your ADN, and then I'm going to take an online BSN, and it's
Right.
management and research, and there's a little bit more of added value if you want to go into certain roles. You want to become a charge nurse or a manager or a director. You need your BSN into your
Right.
MSN,
Which
or
is now the
you
minimum BSN. Yeah.
now the minimum, right?
Hmm.
Or if you want to get into research and policy, then you need a BSN. Um, but there's added benefit that
And
nurses have,
pay sometimes.
and pay, right? Like
Hmm.
if you work automatically, like at least in Colorado, if you work at a magnet hospital, you're automatically making more money because you have a BSN compared to a non-magnet hospital. You may or may not make the same, but you probably are making less, I would say, in my experience.
And what's interesting, a lot of the reason I got my bachelor's in paramedic care actually was because, so I've never worked for an ambulance service. I've only worked for the fire department.
Mhm.
But to be a captain and above, you had to have a degree. And to be a chief, you had to have
Hmm.
a master's. And that might just be an Arizona thing. And I don't know if that's the state rule or it might just be culture rather than
Right.
anything else. But um, there was incentive. I was like, okay, well, if
Yeah.
I want to okay, I'm 3 years into this. I probably want to be a captain at some point. I was testing for other departments. I was like, well, let's knock this out. But yeah, there was incentive. But EMS, I will say, like strictly EMS does not get any incentive. You're
Mm-mm.
medic on the box with whoever, and it is what it is. They don't care as long as they're staffed, So
Exactly. Yep. Just a warm body. Yep.
yeah.
Uh, but you bring up lots of good points, and I think all of us are, maybe not all of us, but I would say the majority of us are probably feeling that our career field needs to really make a change, and go in a different direction. And yes, there are lots of drawbacks to pushing for advanced education and recognizing our advanced education. But if our profession wants to be considered a true profession, not just certifications and
A craft.
a
Yes.
craft, and get on the level of, we'll compare it to nursing because nursing
It's the
has,
most direct. Yeah.
right, and nursing has fought so hard to get to where they are in recognition and pay and all of these things that I would say most EMS people are asking for. We have There has to be a huge culture change. But
Well, you look at the European models and the
oh
master's just like I think just like the starting, like for most of
yeah,
them, like they're
yes,
insanely educated.
yes. All of the paramedic, like I've worked with paramedics from Germany, Canada, Norway. They're all at a minimum bachelor's degrees,
Yes. It's
and
you go to college for that. Like,
that is your thing. Yeah, like I remember, as a flight paramedic up in Canada, and the first time her and I met was down in Haiti, and they're not just called paramedics; they're like advanced paramedics, or the name is escaping me. But she's like, "Yeah, I went to school for like 6 years, so I could work on a helicopter." I was like,
gosh,
"What?" And
that's crazy.
she, I was like, "You are the smartest woman I have ever met. I
Well,
feel so," and like her and I were both paramedics, but I was like, the amount of knowledge that I do not have compared to her is wild. Like
well,
the
she's crafted all that
Yeah,
knowledge in that time and spent the I think something people miss with education as well because we're in a very large time of anti-intellectualism and well, I don't need that, whatever.
yeah,
What people forget is like, speaking, I'm currently in a 3.5 year DNP program.
Woof.
Yes, oh gosh. Yeah, sure. Some things could be cut down. What I have realized though over the course of this program is really when we're talking about advanced education, is it's they're really looking at your grit. And I don't want to hear the thing, oh, they're taking your money. Blah, blah, blah." No, no, no. It's do I have the resilience to stay at this
Mm,
for 3.5 years? And yes, I'm repeating concepts here and there, but my critical thinking, phenomenally better than it was. I've been a good critical thinker, but every time, like I was saying earlier, you level up, you you just get new tools to use,
mhm,
like if I went and worked back on a truck right now, I would run circles around the old me as a paramedic because of just the larger scope and view I have of EMS and medicine in the world that I just didn't have.
right. Yeah. Oh, yeah. No, I don't know. I think we're headed in the right direction, but I think we have a long, long way to go in our EMS profession for to get to where we want to be.
And I understand like people have been doing this 10, 20 years, yeah, it's unreasonable to go back and get a degree
Yeah.
probably at this point, and that's totally fine, and I also understand advanced education is not for everyone, lifestyle-wise,
Mhm.
personal choice, I never wanna force anyone to get more education if they don't necessarily find the value in it, that's fine,
Right.
but those that do have the desire or the drive should be incentivized in some way.
Yeah. Yeah. I agree. I know you've kind of touched on this as like the knowledge gap, but what would you say was the hardest adjustment from moving from the truck to like in hospital bedside?
The hardest part, and actually we made a joke about this, in nursing school, was the first thing our instructors told us were like, "Check your medic at the door. You are a
Ah,
nurse now. You are not a
yep.
medic." And I'm like, "Ah, okay." I was like, "Whatever. What does that mean?" And my first week, I was working per diem or maybe I was full time. I think I was full time as an ER paramedic at one of the hospitals in Tucson. And then they hired me as a new grad nurse because I was already there working. And there were 3 really awful airways that week for some
Oh,
reason,
I can see where
and
this is going.
as a paramedic there, I would just take over. The
Uh-huh.
doc or the MP or whoever would be like, "You got it? Yep, sounds good. Okay, what do you need? Do you want me to put in orders? Yep, sounds good, cool," and I would tube, and we'd be done with it. As the nurse, I
No, no,
specifically had the
no.
medical director come up and was like, "Hey, I can't get the airway, can you go do it?" And I'm like, "I can't." And he goes, "Well, I said it's okay." I'm like, "Yeah, but I'm hired as an RN." Now and I don't technically actually think it'd be an issue in the state of Arizona, but I was like, I don't have a competency though with HR that
Mhm.
says RN intubate. I've got one as a paramedic. I was like, he's like, well, I say it's okay. I'm like, if I don't get a piece of paper from HR that says it's okay, the state doesn't care. We can do, it's, one of those things. But I'm like, no. And so I was
Yep.
like, happy to assist you. And then we had a bad crike that, actually there was 2 crikes that week. And I was like, I can't do any I can assist you best I can. Of course, yes, pre-hospital setting as a flight nurse, yeah, I can do all those things,
Mhm.
comma. Third part honestly was like keeping those boundaries and setting back because like I'm like, I know how to do all these things, I remember we need to needle someone and like I working bedside, I can't do that. So
Yeah.
um the transition was just hard and learning my role and kind of talking to me is realizing that most of my role, especially as an ER nurse, was delegation. And,
Mm, mhm.
they talk about it nursing school, and I'm like, okay, whatever. No, no, no. You're really just coordinating care, honestly. Like
Yeah.
that, a bunch of paramedics working in the ER there that were awesome and really took care of pretty much everything. But my role is to make sure everything got done in a timely fashion in the right order versus doing. So I had to kind of sit back and go,
Mhm.
okay, well, am I anticipating the patient's needs in a larger sense? Then going further too, like I actually haven't touched on this, is about 4 years into flying, when I'd moved to Texas, 3, 4 years, I realized I still had some gaps. And so I went
Mm.
back and worked as an ECMO ICU nurse, working bedside and working as a specialist. And I was like, oh, there's still more I have no idea about. Awesome. Great.
Yep.
And, we fly ECMO and we do great training. But again, there's still something we said about being there for 12 hours with the patient.
Yep.
Just was very interesting trying to bridge those gaps in my head and go from like, okay, you don't have to be the one doing all the things. You can delegate, coordinate. And then as a medic, still working at the fire department at the time, just sitting back and kind of being like, okay, well, what if I was the nurse receiving this patient? What would I want done? So
Mm.
it just kind of changed my trajectory with a lot of things.
Yeah. No, those are all great points. And I'd probably agree with you that for me, the hardest part was, now I have to ask permission to do
Hmm.
things. Um,
Hmm.
but then remembering that, okay, I can't do that in the hospital. While yes, I can do that in the field, I'm in a different capacity. And remembering that capacity was probably the most difficult thing for me when I transitioned into the nurse role. But then also just, being able to set those boundaries. I elected to not stay in the ER when I finished nursing school because I was afraid that I was going to transition from the emergency department paramedic into the nurse role. And not just me, but everyone around me was going to get those lines blurred.
Yep.
And I was afraid that something was going to happen and, I was going to try and step in and I'm gonna be like, ooh, I can't do that. And
Yep.
I didn't want to put myself in that situation. So that in conjunction with, I also felt that I probably wasn't going to learn as much as a new grad ER nurse than I would as a new grad ICU nurse because I'd never been in the ICU. Like I'd done some clinicals up there and then, my clinicals with Creighton
Hmm.
in,
Yeah,
in an
the IC
ICU.
rotations we did.
Yep. Like huge knowledge gap
Hmm.
recognized. And so I was like, okay, if I stay in the ER, this is where I'm comfortable. This is what I know. Um, I'm going to learn a few things, but I feel very comfortable down here. Let me go somewhere where I am not comfortable because I know I have a knowledge gap and I want to fix that. And then I hit the ICU and I was like, wow, I know literally nothing, not just about
Yep.
ICU, but then I decided to pick NICU on top of that in a level 4. And I'm like, cool, I got a singular day of NICU lessons in nursing school. And here we are. And I know absolutely nothing about these babies or the pathophys or the meds that we give or why we're giving them, like, oh, you know, 22 weeker at 200 grams. Sure, why not?
So niche. And yeah.
Like,
Yeah.
so, like, just identifying that there was that knowledge gap also, and I was like, wow, this is this is really hard.
Hmm.
And back to your point, you hit on it. Going into nursing school, everyone was like, "Oh, you're gonna be fine. You've been a paramedic for so long." I was like, "This is hard. Like,
Yo, yeah. Yeah. I was
you're
looking at my classmates. I'm like, are y'all
you
having a good time? They're like, no. I'm like, okay.
no, right?" And like half of my class was not healthcare prior. They they did something else. It was an accelerated program, but like they were like, "Oh, I had my own business or I worked in finance," and I'm like, "What? I would not be
To be
caught
paramedic.
dead going back to nursing school without prior healthcare experience."
Awful. It
It
was
was
awful.
terrible, terrible. But
I
yeah,
actually want to bring up a point that I was thinking about is, we talk about, we can't do anything without permission necessarily. I think that's a bad rap overall that people give nurses. What I definitely gave nurses. I
mm,
remember putting my foot in my mouth because someone was like, "Oh, yeah, my mom's a nurse. She's an ER nurse. She said she ran like 3 codes. I was like, nurses don't run codes, man," which is so ignorant,
right.
so ignorant. And now being the nurse, I'm like, "Oh yeah, no, I'm
No,
literally running the code
running the
like
code.
that's I all the time."
Yeah.
And with that, I think in nursing and it might just be the paramedic drive I have already, but you can be as autonomous within reason as you want to be working bedside. When you build that trust
Yep.
and, get things done. Like I had a very sick patient. I just I work per diem in the ER still, and we had a literally walk-in cardiac arrest, walked in shortest of breath, coded, one of those, and got Ross fine, doing all the things, and out to the docs, and I'm like, "Hey, I gave 200 in out, started leave out." "Oh, okay, that's good," but there's that trust built there.
Right.
I know my role. I'm not gonna go, "Oh, I switched out your ET tube." Absolutely not. But
No.
let's say, within reason, and so I still get kind of that flight feeling, even when I was working in the ECMO ICU and the CV ICU, like, "Hey, I think the patient needs this, this, and this." "Okay, sounds good. I'll put the orders in." Like,
Yeah.
maybe I'm less apt to act rather than ask first or
Mhm.
inform. There's a time to do and there's a time to pause, which also is
Right.
a different skill in nursing because, yeah, okay, so the patient, for example, the postcode, they need a blood pressure down. So
Yeah.
yes, it's within reason to do like that. But yeah, I think we get a bad rap as nurses that like, oh, you got to ask for permission to do everything and this and that. Like, yes, to an
To
extent, but
to
really,
an a
if
point.
you're competent, you're collaborating. Any good
Right.
provider is going to collaborate with their team,
Yeah.
to figure out because sometimes the nurse has more experience in certain things,
Mhm.
versus the provider, whoever that is, and vice versa. That's why we're all there. We're all necessary in that sense.
Right. Yeah. And you do bring up a good point, and I would I would agree that while it may be a, "Hey, I have to ask this," there's a way to deliver it, and so that it's not really asking, and to your point of it's collaboration, right? Be like, "Hey,
Yeah,
this is what I have. This is what I would like to do. What are your thoughts?" And then to be like,
correct.
I think that's a great idea. Let me throw in orders."
Yep. Because
And
also you have to remember too, they're one person.
right,
You know?
for, for a 40-bed ER or a 24-bed ICU, like they're one person.
Mhm.
But that's why I think that you as a nurse you're very valuable because you are spending 12 hours. If you're in the ICU, you're spending 12 hours with that patient. You know, you know, we can identify the slightest change with them,
Yep.
with their vital signs, and you're like, something's wrong. And then you go and investigate and you start figuring out what's going on and you problem solve and then you come up with a plan and then you go deliver that plan to the doctor and you're like, "Hey, this is what's happening. This is what I'd like to do. Can we do this?" And they're like, "Sure. I have 25 other patients. Sounds great."
Sounds great. Yeah, you want me to put the order in or you got it? Perfect. Yep.
Exactly. And by developing those critical thinking skills, and, rationale, that makes you an even better provider, and you can go and collaborate rather than, compared to, "Hey, we're requiring 100% oxygen, and I don't know what else to do." Okay, well,
Yeah.
now it's a different
It just
conversation. Now it's
gives me no information. Like, yeah.
right, you haven't given me any information, you haven't given me any background, you you haven't told me the interventions that you've tried, you know,
Mhm.
all of those things. And I think for me, that is something that I probably struggled with coming from being in EMS because we don't have that much of like, I don't know, how do I want to phrase this?
Maybe.
Yeah, like it's just two of us or maybe four of us, depending on your crew makeup, right? But there's only if you're on a four-person crew, you're maybe two of those people are medical, maybe an EMT and a
Yep.
paramedic, right? But if you are like, if you're the lead and you are the paramedic, you can only bounce off your ideas so
And your
far,
protocols. Yeah.
right? Because you're like, okay, well, they may be familiar with my protocols, but the EMT doesn't know all of the patho that I have come to
Mhm.
understand, right? So now you're sitting here and you're struggling to bounce ideas. And then you can make a phone call and ask
Sure.
online medical direction, but it's a little different. And so I think nursing school and working in the hospital really beefs up that collaboration and
Mhm.
teaches you how to bounce ideas off of everybody.
Mhm. And I think what's interesting is actually I distinctly remember a call where I was the only paramedic and my captain was an EMT and the patient had like myoclonus, but like seizures that were affecting her mental status. And I was like, I think she's having seizures, but I don't know if my
I don't
protocol
know.
covers this kind of seizure. I mean, I thought they were all tonic-clonic seizures. Or
Hmm.
like, what? And he's like, well, what do you want to do? And I'm like, I don't know. I guess I'm gonna give her Versed. And he was like, all right. And when I go to train, I've trained both flight nurses and flight paramedics, paramedics, nurses, and all roles. And where paramedics struggle coming to flight is voicing and collaborating with
Hmm.
their nurse partner. And where nurses struggle is they want to overly cover their butt when it comes to
Mm.
doing things. Well, let me go tell the doctor we're gonna intubate. No, shut up. Cut it.
Oh,
Cut it. We're gonna have to do it regardless. We can
right.
inform them, like, you know, it's our patient now, it's under our medical director. Like,
Yeah.
come on, and we gotta do a task. And 9 times out of 10, they don't care. They're like, oh, okay, sounds good. My bad.
Right.
Whatever. Because there's that collaboration, right?
Hmm.
So there's the extreme ends, and finding that middle ground is also why we fly nurse paramedic anyway, to
Yep.
try to bridge that. So
Yeah. Yeah. I think probably my last question, because we're hitting that hour mark, is what would you tell someone who is standing at the same crossroads as you were back in the day, whether that be any point in your career, EMT to paramedic, paramedic to nurse? What would you tell them?
if the advice I would give them is, if you are going to want to advance your critical care or go into critical care, advance your medical standing, please just get your RN knocked out. Whether you use it is irrelevant. Getting that knocked out early is just, I see a lot of regret from people who have dropped out or whatever. Paramedics is specifically who I'm talking to. A desire just get it done. Is that you and your family or whoever you're around up for just more mobility?
Mm.
Or a paramedic and you don't desire to go to critical care, because not everyone needs to go to critical care. Who
No,
cares?
right.
But advocate for the profession, see how you can advance your own education and standing within that, whether that be a bachelor's or whatever. Um, and, go to conferences, teach, get out there, get our profession recognized for the work we do. That would be decision really is, what do you want your work life balance to be? What do you want your picture to look like at the end? For me, getting my RN gave me more mobility, so I could enjoy my time off more, have more money to afford the things I wanted to do. But money's not everything, you know.
Nope.
As long as my bills are paid, it's totally fine. I don't always work overtime, even though it might seem like it, because I'm like, whatever, bills are paid this month, I'm gonna take a break. Like,
Yeah.
Uh, so yeah, my advice would just be, figure out what you want to do. If you are a paramedic and even have a inkling that you are going to want to fly or do something else, please just get your RN knocked out. I am a paramedic with a nursing license. That
Hmm.
is, and that's okay. And 100% of the nurses at my base are dual certified.
Yeah.
So like all these nurses that I work with, the three other nurses at my base all went backwards and got their paramedic, because nurses can do that, but we cannot do that. So if you have any mobility to spend the year and transition, just do it, knock it out. I started again as a flight paramedic, didn't use my RN in the flight capacity for a year and a half, but glad I got it, because I would have had to quit flying basically to come back.
Yeah.
So
No, I think that's great advice. I think that's something that I struggled with was, okay, do I go to nursing school or do I not? Do I make this jump? Because I like how you put it. I am a paramedic with a nursing license. That is my profession. Is the career that I love. I will never let my paramedic license lapse.
over my dead body, I don't care
Yeah,
what NP and crazy initials I have at the end of my name.
no, like,
Like,
and I don't know. There's just something for me it's comforting
you're
knowing
probably like
that,
me. I take a lot of pride as being a
right,
paramedic. I
exactly.
love being a paramedic. I am so thankful that I became a paramedic before I became a nurse. And I hope other people feel that pride being a paramedic,
Yeah, yeah, exactly.
because we do
And
get dumped on quite a bit by the healthcare system.
we do, we do, we do. So yeah, I think I would agree with what you said. If you have any inkling of wanting to fly, just go knock out your nursing license, get that extra knowledge, because you're going to be better off in the long run.
Yeah,
It is
it's
going to
not
make
going to hurt by any stretch.
it's not going to hurt by any stretch. It's going to make you a better provider. But yeah, my 2 cents. So
Agreed.
yep. Well, Zane, I really appreciate you taking time out of your very, very busy schedule and coming on and talking about this topic. I think there's a lot of people out there that are struggling with, do they make the leap, and do they cross over to the nursing side, or do they maintain both certifications and licensures? There are people out there that are wanting to have this discussion. So I appreciate you coming on.
Thanks for having me. Appreciate it.
Absolutely.